Hello and welcome for a webinar on anatomy of throat, pharynx and larynx. Dear student, today's takeaway home is larynx because larynx is a very important part of today's study which is quite often asked in examinations. So we are going to deal with larynx a bit in detail. Rest of the part we'll try to cover as fast possible. Let us have some review of nose, mouth, throat, nasal cavity, which is required for breathing, mouth, which is required for chewing, pharynx, which is required for swallowing, larynx, which is required for singing, speaking. Okay, well, before that, we should understand the position of all the structures in a sagittal section of head and neck from top to bottom. You can see first comes here is a cranial cavity which you know has brain and spinal cord in it. Then you can see the vertebral bodies here. Then you can see the epaxial muscles around it. Epaxial means below above the axis. You can see here epaxial muscles. Then you can see the area of hard and soft palate just below the nose, area of hard and soft palate. Then you can see the oral cavity. You have to try to make out from this picture. Oral cavity is here. Then my dear students, there is a esophagus here. And in front of that, there is a trachea here. Trachea bears a flap, is called epigastric. And pharynx is it's a long channel from nose, mouth, and larynx. So it is a nasopharynx here, oropharynx here, and laryngopharynx here. So we'll try to understand these structures one by one. We have already studied the nose, and we know what is nose, what is nasal cavity, and it is required for breathing. You all know that you are breathing that side, I am breathing this side. The function is, of course, inlet for air to the lung. So what we inhale, that is air, and it goes to our lung ultimately. And nose does this warming and filtering of the air because mucous membranes on the ethmoid conchae are meant for that. And it is also required, nose is also required for the purpose of smell sensation, what we call as olfaction. Nerve endings on the nasal membranes of olfactory nerves you find here. Okay, and the next is conchae of ethmoid bone. We have studied the lateral wall of the nose, and we know that there are three types of conchaes: superior concha, middle concha, and inferior concha. First two conchae are of ethmoid bone, and the lower concha is an independent bone. So that is why you can see this green color inferior nasal concha is independent, whereas these two dark yellow color superior and inferior nasal conchae are the part of ethmoid bone, and below that there are metatarsus, and they are self-like bones or scroll-like bones. Okay, they are bony projections which are covered with a mucous membrane for the purpose, again, for smell, for the filtration of air, and for the warming up of the air before it goes inside your chest, or you can say in the lungs. So, and we have also talked about the paranasal air sinuses. The sinuses are air sinuses, and they are paranasal. Para means around the nose, and there are four groups, four pairs of groups in our body on either side of the nose, and they are maxillary, ethmoid, frontal, and sphenoid. Out of these four, ethmoid is having three components, so we call it as anterior ethmoidal, middle ethmoidal, and posterior ethmoidal. So altogether, you can see all these paranasal air sinuses in this picture beautifully shown. You can see the frontal sinus here, you can see the sphenoid sinus here, and you can see the maxillary sinus here in the maxillary bone, whereas ethmoidal sinuses is in different groups. All are connected to the nasal cavity, all are lined with the mucous membrane, and they open in the metatarsus on the lateral wall of nose that we have studied yesterday itself. And they are prone for cold and allergies. Okay, and that is why they get filled with the mucous membrane, and that is what is called as sinusitis, sinus headache also, what we can call. So sinusitis is a common element after the common cold. सर्दी झाल्यानंतर सर्दी दाट झाली की ती सायनोसायटिस मध्ये परिवर्तित होते. It get infected also. So that is why paranasal sinuses are of prime importance. Now we'll try to understand a little bit about mouth and oral cavity and chewing. We have studied mouth at length that day. So already we know everything about the mouth. The function of the mouth is to bite and chew. चावणे आणि चघळणे and for formation of words, so it's called as speech, and for the purpose of taste means serve, and also for the purpose of tactile, especially the lips, which are meant for the lip kiss and everything else further to that. The components of mouth are lips, cheeks, palate, jaws, and teeth, and salivary glands. Everything we have studied during our revision, on various parts of the head and neck. I think we have not talked much about the teeth that we'll do today. And the mouth is lined by thick stratified squamous epithelium, which is also called as stoma. And inflammation of this is called as stomatitis. Okay. Mouth has got a vestibule in front of the teeth and behind the lips, so small potential space. And oral cavity proper is behind the teeth up to the uvula. So after that comes your pharynx, oropharynx. So this is all primary thing. Every student, this even school children must know all this. Now let's talk about lips a bit. They are for the closure of mouth. So to open and close, just like a door. They keep the food inside, and plus also they help you to make sounds with what we call as speech. Okay. Without lips, you cannot complete some words. Try to open your mouth and try to speak without closing the lips. It is difficult. And by closing the lips, it is difficult. It's speak. Plus tactile, I told you all that touching, that is kissing. A structure, core of sphincter shape skeletal muscle, and that is called as orbicularis oris. It is circular and around the oral cavity, so it's called as orbicularis oris. A red margin transition from keratinized skin to oral mucosa. You can see the margin between the skin and the mucous membrane. Some mucous membrane of the lip is exposed, okay, or exposed outside, and a red because clear color lets underlying vessels show through, because the vessels are seen, or because of transparency it is having red color. And there are no sweat glands and sebaceous glands on the lips, and that is why thus they need to be made wet. That is why while speaking you have to do like this, like this you have to do again and again, because there is no sweat and sebaceous gland. That's why, especially in the cold season, you have to do it again and again, and that causes lots of problems. Now let us talk about the cheeks. Side of the face has got a cheek, and they form side of the mouth as well. This is cheek, okay. And buccinator muscle, it is instrumental in swallowing, and it connects to the pharyngeal constrictors also. So here there is a buccinator muscle, okay. Buccinator muscle is not included in the muscles of mastication, but it also helps in mastication. Now, hard palate we have already seen. It is made up of maxilla, so what we call palatine process of the maxilla, one on each side, so maxillae, and plus separate palatine bones. Okay, soft palate is posterior extension here. Posterior extension of hard palate, you can see it is soft, that is why it's called a soft tissue. And palatoglossal arch, which is going to the tongue, front one, palate to tongue, and palatopharyngeal arch, which is going behind from palate to pharynx. They form fosses on each side, and in the triangular fossa, tonsillar fossa, you can see the tonsils located between these two arches on each side. And in between these fosses, you can see a hanging uvula here, what we call Perdjib in Marathi. Okay, this is all about palate. And jaws now. So there are two jaws, upper jaw and lower jaw. Upper jaw is made up of maxillary bone, and lower jaw is made up of mandibular bone. Jaws are anatomically called as alveolar process of maxilla and alveolar process of mandible. They hold teeth in it, so they form one type of joint, and that is called as peg and socket joint. It is a type, it's a type, one type of a fibrous joint, and they occlude in chewing. So while chewing, they get occluded, so they get pressed. That is why we are able to eat mostly the hard substances which we require to eat. And for the purpose of better understanding, we should know the dental formulae which we come across throughout our life. During our childhood, we get a milk teeth, what we call as deciduous teeth. They are also called as baby teeth. Okay, they emerge at the age of 6 months up to the age of second year. So 6 महिन्यापासून 2 वर्षापर्यंत जे दात येतात त्यांना आपण दुधाचे दात म्हणतो, तुम्हाला माहिती आहे. And they are replaced by permanent teeth again after 6 to 12 years. It's very easy to understand. 6 months la 6 years and 2 years la 12 years. Okay, and the last, because this deciduous teeth formula is of 20, total 20. Okay, 10 वरती आणि 10 खाली, म्हणजे 5 ह्या बोलतात 5 त्या बोलतात, 5 5 5 5, so 5 5 5 5 20. Then this is an intermediate formula before wisdom teeth, so there are 28. 28 means 14 14, 7 7 7 7, and the last wisdom teeth or wisdom one tooth, that is the third molar. It erupts at the age of 17 to 25 years, and or remains in the jaw itself. Now you all are in this phase of life. I don't know, most of you may not be having this wisdom, especially boys get later, girls get earlier, and then the formula becomes 32. That means 16 16, 8 plus 8 plus 8 plus 8. Okay, key to healthy teeth and gums is flossing, visiting dentist regularly every 6 months. You have to keep your teeth very clean starting at the young age, at 3 to 4 years. दात रोज घासले पाहिजेत. So you have to have a good, oral hygiene. You can see the names of these teeth: incisors, then what you call central incisor, lateral incisor, then canine. Then we get a premolar, 2, and then 3, then 3 molars here in the permanent teeth. This is a deciduous teeth, so there are no premolar, first molar and a second molar. This is about 1 2 3 4 5, 5 plus 5 10, 10 plus 10 20. And here you can see the central incisor, lateral incisor, canine. Then we get a premolars 2, 1 and 2, and then we get a molars 3, 1 2 and 3. So 1 plus 1 2, 2 plus 1 3, 3 plus 2 5, 5 plus 3 8. So this is 8 on one side. So 8 plus 8 16, 16 plus 6 32. Everybody should know the names of these teeth. Okay, once upon a time there was a question asked on teeth also. I know during my time question was asked on anatomy of teeth, longitudinal section of a teeth for 16 marks, remember. So you are not going to become a dentist, so I don't want you to get in the depth of the teeth, but at least you should have a gross knowledge about gross anatomy of teeth. Now the structure of the tooth, what I called you longitudinal section is here. The upper part is called as crown, and the lower part is called a root, and in between these two, crown and root, there is a small neck. And if you consider the structure, that this is made up, crown is made up of enamel outside and dentine inside. Okay, and you can see the dentine tubules, and then deep inside there is a pulp cavity which contains the blood vessels and nerves, so it is alive. That is why it is painful. And this gingiva means gum. Gums are also called as gingiva. So inflammation of gum is called as gingivitis. Okay, and inside the root has got a cementum, and then is a root canal here, and there is a pediorangular ligaments here, and there is a apical foramen here which leads to the bone, and this bone is a jawbone, and above there is a maxilla, and below there is a mandible. So this is a longitudinal section of a tooth. You have to remember all the structures from above to downwards. Now what are the jaw muscles? The jaw muscles are also called as muscles of mastication, and there are 4 of them commonly, and you know those. This is also a common question in examination, muscles of mastication. Okay, first one is masseter and second one is temporalis. These are 2 important muscles which elevate mandible. That means they are made for the closure of the mandible. Another is medial pterygoid, and another one is lateral pterygoid. So medial pterygoid is side to side, made for side to side chewing, and the lateral pterygoid is for the translates mandible anteriorly, that is part of opening. So 1 2 3 4, these are the 4 main muscles of mastication. But digastric also helps in the depression of mandible, it opens the jaw. So you can also include digastric as extra muscle for the purpose of muscles of mastication. Even buccinator helps in chewing process. So chewing is a circular motion. So there's a combination of different muscles here. So at least these four muscles, their origin, insertion, and the muscle and the nerve supply you have to know, and that becomes a good short note on muscles of mastication. And plus we have talked about the tongue at length day before yesterday, anatomy of tongue. The function of the tongue is to position the food between the teeth. So it helps you to take food between the teeth, so that there can be a chewing, crushing, and it also helps in formation of words in a speech language. And that is why we can speak any type of language. If there is no tongue utilized, there is no articulation and there is no speech. Words will not get formed. Now it is made up of muscles. It is a muscular organ. So there are four intrinsic muscles. There are four extrinsic muscles. Intrinsic muscles, they are two longitudinal, one transverse, and one vertical. That we have seen all that. And extrinsics, there are four of them: genioglossus, hyoglossus, styloglossus, and one palatoglossus. Okay. Now salivary glands also we have studied all of them, and there are numerous salivary glands in our mouth and pharynx, and even in the nasopharynx. Even last 15 days back, one small important salivary gland was discovered by the anatomist in Europe. There was a news on the different media. Intrinsic glands means all over the mucous membrane of the tongue, palate, lips, lining the cheeks. So there are many, numerous, 400 to 500 minor glands are there in your mouth. Remember, but extrinsic glands are only three pairs. 1, 2, 3. That is parotid, submandibular, and sublingual. We have studied all these extrinsic glands. They secrete more saliva when eating or anticipating. Anticipating means जेवण समोर येणार म्हणजे त्या ग्लँड सिक्रेट करायला लागतात, त्याला अँटिसिपेटिंग म्हणायचं. And intrinsic here, they keep the mouth and every part of the mouth related moist. So you remember this parotid and submandibular more for example, but we have studied this gland, so I don't want to waste time in this. Now what is saliva? You have studied this topic in your physiology in digestive juices. That means when you have studied digestive system in physiology, somebody must have taught you the various digestive juices. The first digestive juice is saliva. Second one is gastric juice. Third one is bile juice. Fourth one is intestinal juice. And the fifth one is pancreatic juice. So there are 5 digestive juices in your GIT. The first one is saliva. Today's part of study. It moistens the mouth. It dissolves food to be tasted. Okay. It weights and binds the food together. And it contains amylase to start starch digestion. And it's called as ptyalin, okay? Don't say ptyalin, ptyalin. And contains bicarbonate to neutralize cavity causing acid produced by bacteria. It also contains antibacterial and antiviral enzymes and cyanide-like compound to kill harmful microorganisms. It also contains protein that stimulates growth of beneficial bacteria in the mouth. So salivary juice you have already studied in physiology. So you count that here. You can use it for both anatomy and physiology also. Now we will go to the today's topic proper, that is pharynx and swallowing, because it is related to larynx very soon. Back of the mouth, oropharynx to laryngopharynx, okay? And nasopharynx is a passage of air alone. So for nasopharynx is meant only for the air, whereas oropharynx and laryngopharynx parts are meant for air and food. And food and air mix and then they get crossed. You can see this diagram. Okay, air is coming from above, food is coming from below. The pharynx portion is getting mixing of these two, and they are directed. Food is taken forward, backward. Here you can see backward into the esophagus and trachea, the air. Now entry is pharyngeal arches. Exit is glottis, that is epiglottis. We call it as a lid. Epiglottis closes the trachea in order to avoid entry of food in the trachea at the time of deglutition, swallowing. Pharyngeal constrictors squeeze food through it. Pharyngeal tonsils protect the, is meant for phagocytosis. And there is a Waldeyer's lymphatic ring made up of those 4 tonsils which I talked other day. Two palatine tonsils, one lingual tonsil in front and one pharyngeal tonsil behind. So 1, 2, 3, 4. They are connected by lymphatics to each other and they make a ring, and that ring is called as Waldeur's lymphatic ring. Okay, but something goes wrong at the time of deglutition. It causes choking. Okay, ठसका लागतो आपल्याला because food has to enter in the food pipe and air has to enter into the air pipe. So pharynx and swallowing, you can see the movements here. Focus on the muscles and arrangement of the mouth, cavity, pharynx, larynx, epiglottis, and trachea in this diagram. Now this is important part, and this is a takeaway home today because questions are mostly asked on larynx. 10 मार्काचा प्रश्न पडतो. Larynx and singing. I am using this word singing. You can use talking, no problem. So, or also you can say larynx and phonation. Phonation is to produce voice. That is called as voice box. Because of that, it is called as voice box. So channel air out of trachea and respiration. Vibrate to produce sound for speech, song, or phonation. Plus, it is helping in protection and deglutition. These are the functions of larynx. Structures of larynx, let's see. External skeleton or frame of cartilage and internal vocal cords and associated muscles. So externally there is a frame of cartilages, and inside there are vocal cords and the muscles which help you for the purpose of production of voice, or you can also call it as phonation. It is located in front of the laryngopharynx in anterior midline of the upper part of the neck, and the synonym of larynx is voice box or organ of phonation. I told you this is your voice, larynx is your voice box, mouth is your speech box, and paranasal ear sinuses are your sound box. That is why we can understand somebody else speaking to us, and our speech also reaches the other person if all these three boxes work properly. Now in males it is 45 by 44 by 43 by 36 millimeter in size. So it is in millimeter, and in females it is 36 by 41 by 26 millimeter. So in case of female, the larynx is smaller as compared to males, and plus there is a different design of vocal cords, and that is why the pitch of the voice in females is high. That you can at the age of puberty, boys turn into the adult male voice. So there is a widening of the box as well as the vocal cords, and that makes a changes between the adult male and adult female. Skeleton of larynx is composed of 9 cartilages altogether, because there are 3 paired and 3 unpaired. The thyroid cartilage is the biggest cartilage amongst all these 9, and just below the thyroid cartilage there is a cricoid cartilage, and above there is a epiglottic cartilage or epiglottis. So these are unpaired. That means they are single, and single. Whereas here arytenoid, corniculate, and cuneiform, these are double. Paired. So altogether there are 9 cartilages. You have to remember the names of this cartilage because this is a common question in examination. Well, the joints and ligaments of the larynx also a part of the study of anatomy of larynx. We should know those also. Some paired joints we talk about now. First is cricothyroid. Cricoid cartilage and thyroid cartilage madla joint ha cricothyroid. Cricoarytenoid means cricoid cartilage and arytenoid cartilage madla joint म्हणजे cricoarytenoid joint. And arytenocorniculate joint means arytenoid cartilage and corniculate cartilage madla joint. If you remember this well and good. Ligaments and membranes which help them are extrinsic and intrinsic. Extrinsic ligaments are thyroid, cricothyroid, cricotracheal, and intrinsic ligaments are cricovocal, vocal, quadrangular, and vestibular. If you remember, these ligaments is also well and good because it is very important organ upper body, because it helps for production of voice. Without voice, you will not get a speech, and without voice and speech, you will not add resonance to it, what we call sound box. It's all useless then. Now, what are the muscles of larynx? What muscles are located in the larynx which helps it to carry out its function? There are 1, 2, 3, 4, 5 extrinsic muscles. Everywhere there is extrinsic and intrinsic word. Extrinsic means coming from outside to that part. So palatopharyngeus muscle, salpingopharyngeus muscle, salpingopharyngeus muscle, stylopharyngeus muscle, thyroid muscle. Thyroid muscle we have already studied in the what you call infrahyoid muscle. So thyroid muscle and sternothyroid. These are very common muscle, but you have to remember these three also. So altogether 5 extreme muscles we find in larynx. And intrinsic, there are 9 types of intrinsic muscles attached to laryngeal cartilage for its movements. And they are, I told you, like tongue, they are not named as such because they are either longitudinal or vertical or transverse likewise. Now this is the skeleton of your larynx. This diagram is important. We have to draw this diagram because it is showing all the cartilages and most of the major joints as well as the ligaments. This yellow color is a bone and this bluish color is the cartilage and the remaining things are the membranes. Okay, you can see the cricothyroid ligament here, cricotracheal ligaments here. And when trachea begins after the end of the larynx, and trachea is always in the form of tracheal rings, and they are C-shaped tracheal rings. From behind they are not cartilaginous, there is a membrane on the back side. So tracheal cartilages you can see here, and you can see all the names of these various cartilages. And this thyroid cartilage has got an eminence here, and this eminence is quite prominent in males. I can see you on my neck. This is the eminence. म्हणजे सगळा उंचवटा आहे, ह्याला आपण म्हणतो laryngeal prominence. We call it as a laryngeal prominence, or you can also call it as the tip of the thyroid cartilage. But in common language, it is also called as Adam's apple. It is Adam's apple because it is present in Adam. Adam means boys, males, and Eve means females. It is absent in Eve because Adam and Eve is story which is present in the book of Genesis in Bible. In all the Abrahamic religion, they believe that Adam was the first man made by the God, and Eve was the first woman made by the God, and God had prohibited this couple to not to eat the fruit, the apple fruit of the tree of knowledge, but due to satanic influence, they try to eat it. You eat it fully, and it goes inside her stomach. But when the Adam was eating it, God shouted, and it got stuck up here. इथं अडकून बसला तो ऍडमच्या. तेव्हापासून सगळ्या पुरुषांना इकडं असा उंचवटा आला, अशी ती आख्यायिका आहे. But science doesn't believe in all this because the male and female are made different by the nature. Male हा female पेक्षा वेगळा असला पाहिजे, opposite to each other, तर ते अट्रॅक्शन होणार असं त्याच्या मागची ती भूमिका आहे. पण आपल्याला ते ऍडम्स ऍपल का म्हणतात ती स्टोरी माहिती पाहिजे. Cricothyroid ligament is usual site of emergency tracheostomy. Cricothyroid ligament is here. Here you can enter into the windpipe by making a small hole, and that hole is made here because person cannot take air through mouth and mouth or nose or mouth. In that case, direct entry is given to the air from here, and that operation, small operation, is called as tracheostomy. Yes, you have to use yes here. Tracheostomy means it is kept open and one pipe is inserted, so from directly air will go to the lungs, so person will get saved from that emergency. And this operation is very common usually in cases of unconscious patients and patients who have entered into the coma. Here you can see the laryngeal cavity and the vocal cords. Now we are inside the larynx, and you can see the vocal cords closed here and open here. You can see the anterior part of vocal cords and posterior parts of vocal cords. Sometimes short note on vocal cords is also asked. Okay, so that is why we have to know vocal cords as well. Other information about the larynx we'll try to understand through this slide. What is the nerve supply of larynx? Internal, external, and recurrent laryngeal nerves. These are all branches of the vagus nerve. They supply the larynx. Blood supply to the larynx is from superior, inferior laryngeal arteries, whether there is by superior and inferior laryngeal veins. And lymphatic drainage is to the deep cervical lymph nodes. So we have to remember, and these are branches are of the branches of thyroid uh, arteries. And what is voice box? What is speech box? What is sound box? I am telling you again and again. You can see larynx is called as voice box, mouth is called as speech box, and paranasal air sinuses are called as sound box. Now, what applied anatomy you get through this study? First, adenoid. Adenoids means inflammation of the pharyngeal tonsil. Pharyngitis means pharynx, inflammation of the pharynx. Laryngitis means inflammation of the larynx. Gingivitis means inflammation of the gums. Dental caries means decaying of the teeth. Pyorrhea means pus in the teeth. Vocal nodules. Vocal nodules means singers nodules. Those singers who sing a lot and they give strain to the vocal cords. The vocal nodules. Laryngoscopy means you have to insert a scope inside the larynx for the study. Laryngeal prominence means Adam's apple. And tracheostomy, I told you, you have to enter the trachea through the cricothyroid ligament where you can save the person's life. And with this, my dear students, I have ended today's webinar on throat, mouth, and larynx. And you can see a beautiful picture here during the publication ceremony of my general anatomy book with my family here at my place on the terrace building. And with this, I end today's topic. And if you have any question, you can ask me. We have last 1 minute in hand. Is there any question? Okay. And tomorrow, what you want? Somebody told me to take thyroid. Are you okay with thyroid? We can talk on thyroid tomorrow. Yes? Because it all related to one another. Okay, we'll take thyroid tomorrow. And I think there are no questions. So let us stop here. Thank you and have a nice day.